evening, everyone. My name is Mandy, and I'm the chair of GlobalHOME.
And my name is Megan. I am the GlobalHOME Events Coordinator, and welcome to Electives Night 2015.
Tonight is all about you. It's about where you want to take flight and explore the world. For Stage 3, we hope you get a lot out of these presentations. Embrace the wealth of experience from the students who have gone and travelled the roads before you. For Stage 2, we hope this helps you prepare for your third-year elective, or even organise an extramural placement at the end of this year. And for Stage 1, well, it's never too early to start thinking about your electives. So, no matter what kind of doctor you want to be, there's no denying the importance of meeting your future colleagues in this interconnected world. We will start this evening with a presentation from the Associate Dean International, Kirsty Foster, to tell you about the Office of Global Health. We are super lucky to go to a university that can offer us placements in leading institutions in every continent of the world. A lot of hard work goes into setting up these relationships. So put your hands together for Kirsty Foster.
Okay, thanks Mandy and Guggen, and thanks very much for inviting me to come along and speak here tonight. How many people in the audience are third years? Second years? Ooh. First years? Right, okay. Okay, well I'll skip through some of the slides which are rather detailed about, and then the third years will recognise some of them from the orientation that you had at the beginning of Stage 3. But this was an opportunity to take a little bit more time and perhaps answer some questions. And as Mandy said, your elective is a real opportunity to do something that you wouldn't normally do. To experience in medicine something that may be slightly outside the medical program that you have in your organised rotations. So it's compulsory in Stage 3 as a 12 credit point unit of study, and it's 8 weeks, which you're encouraged to do either 1 8-week placement or 2 4-week placements. But certainly not 8 1-week placements, because that doesn't give you enough time to settle in anywhere. These are the scholarships that are available through Sydney Medical School to support students going on elective. So those of you, particularly in first and second year, may like to just look at the number there are and think about where you would like to go, what you would like to do, and in particular how your CV and your application can be prepared for these. For those of you in third year, I'll just take this opportunity to remind you that they close on Monday morning for this year. So if you want to apply for the Dean's Scholarships and those ones in the top section, then the closing date is 9 AM Monday. So I'm sure lots of you being very well prepared in third year have got your applications in already. But you can see there's a lot of support. 91% of our students do an elective placement, the rest are doing honours projects, and some people manage to do honours and an elective. That has to be approved by the honours coordinators. And 65% of our students who do an elective do so overseas, which is fantastic and goes towards our real aim in this faculty of producing graduates who are very globally aware. This map shows the red dots on it, if you can see them, show where our outbound medical students went on their electives in 2014. There's 55 countries that they visited, and you can see the spread is all over the world. One of the things I'd like to encourage you to do is remember that global health is global, and that includes Australia. And it's interesting to note from our data got through the Office for Global Health that of 186 elective placements, that's 4-week placements, in 2014 that were done in Australia. Only 36 of them were done outside Sydney Medical School, and that is a waste of an opportunity. A few people have very good reasons to stay in Sydney, but we'd certainly encourage you to apply for electives at least other universities if you have to stay in Sydney. But take this opportunity to spread your wings, to go somewhere else, to experience somewhere else in Australia or overseas, obviously. Indigenous health is one where we have very few placements, and Dr. Lilon Bandler is very happy to support people trying to find Indigenous places if you're interested in that. Through the Office for Global Health, we have 32 exchange partnerships in 26 different countries, and we have 91 placements available, which this year we're making all 91 of those placements available to third-year students for their elective in the first instance. This is because it is quite a difficult process finding an elective placement, and when we've got these exchange agreements, it makes sense to offer them to third years first. For you, those of you who are in second year, I can tell you that if there are some of those places left over, they'll be offered to second years later in the year as extramural placements. And Sydney Medical School is also a member of Global Health Learning Opportunities, or GLOW, and that network can help Stage 3 students, elective students, access different placements through that. And Fiona Thien from the Office for Global Health is our university contact with GLOW. These are our placements. So you can see that they are, as Mandy said, they're high-ranking universities across the world, and they are in a range of countries from Argentina to Zambia, so literally A to Z of the countries. You can see here Cambodia, Canada, Chile, China, France, Germany, India, Indonesia, Micronesia, Myanmar, Sweden, Thailand, USA, Vietnam. A wealth of opportunities, so whatever you're interested in, there is a placement there that you might be interested in. Some of our placements have been less well taken up over the last few years, and these ones here, Tonga, Niue, Micronesia and Zambia, are 4 of the least used ones. Zambia has a new scholarship available, which has been made available by Emeritus Professor Doug Saunders, who used to be head of the Department of Obstetrics and Gynecology, and he has a very close relationship with the hospital in Zambia, and has now provided a scholarship for the first time this year to be able to take up places there. So that's a supported one as well, so we definitely encourage you to apply for those. And you can see here how fantastic a past student has found this, and I know you're going to hear more about from past students shortly. So this is the application link for third years who will need to do this fairly soon. But I just want to finish by showing you a few photographs, because I think it's hard to conceptualise when you see that list of places. But this is to show you just a couple of the places that I visited recently. Chulalongkorn University in Thailand. You can see what a beautiful campus they have there. And these people here, this is Professor Unop, who is my equivalent at Chulalongkorn University, and this chap here is called Mr. X because his name's far too long to pronounce, so they just call him Mr. X, and he is the person who liaises and looks after the incoming students there. And when I was there last July, we visited the accommodation that they provide on campus, and this is one of the accommodation blocks. I think this is they segregate the sexes, so I think this is the male one. And there you can see a photograph of the sort of accommodation that's provided. This is another opportunity we have. Another of our partnerships is in Vellore in India with the Christian Medical College Vellore. And there's the opportunity to be both in Vellore itself, in the big hospital there, and also do a placement here in the rural unit for Health and Social Affairs Department, which is out in the country. And these, actually 2 of these doctors here have been over at Sydney University, so they're familiar here. They came on an Australian Award Fellowship Programme, and the beams on their faces are actually the response when I said, how do you find our students who come here? And that was their response. I was just taking the photograph. And it was really about, we're looking forward to having more, because we love them here. It wasn't, they're a bit funny. And this is the accommodation in Russia that they provide, so it's right beside the community clinic there, and the bicycles are provided for students to get about. And you can see here the clinic there and the waiting room. So not like anything you would ever experience, you've experienced before. And certainly in my travels, I haven't got time, I could go on and on showing you hundreds of photos, but I know you've got plenty to see from students who've been overseas. But just wanted to finish with the facilities, the sort of facilities I've seen overseas. This is in Thailand as well, at Mahidol University in Bangkok. This picture is their library, their student library in their brand new building. And this one is in Shanghai in China. This was the international students in their common room where they were doing a bit of study and doing a bit of chit-chat. I think that's the same the world over. And this is actually a swimming pool beside a hospital in Thailand that the students were able to use. So your clinical schools will help you. The Office of Global Health will be advertising the placements in April in all of those places, except the ones, we have some like Karolinska, which has been advertised already because they need to know who's coming soon. But the third years, I think, will be familiar with those details. For those of you in first and second year, do remember that it's not just about where you want to go, it's thinking practically about whether it is somewhere you're prepared to travel, that you want to travel, that you can get the funding to travel to. Remember to check all the other details like visa, insurance and so on. One of the things that is fed back often is that language is an issue. You can't expect everyone to speak English. So we do encourage students to, if they're thinking of going to somewhere where English is not spoken, as is many countries of the world, to try and learn a bit of that language before you go, because it will enhance your experience. So those of you in first year, if you've got a burning desire to go to Vietnam or China, you could start now learning the language, and it would definitely enhance your experience there. You'd be much more able to speak to patients and people in the ward, of course. You wouldn't have to rely so much on interpreters. So grasp the opportunity, make the most of it, plan early, read all the information that's provided online there on Blackboard in the electives module, and on the OGH website. We've got lots of information on the Office for Global Health website, including reflections from people who've already been. Those reports are all up there for you to read. So talk to others as well, but most of all, enjoy. And the contacts there at the bottom, Fiona Thien, as I've mentioned, is in our Office for Global Health, and she deals with all the elective exchange placements, so please direct queries to her. Thank you very much and enjoy the evening. I'm looking forward to hearing the other presentations.
Our first sponsor for the evening is STA Travel. They are the place to go to sort out all your travel plans. Let's hear from Luke Humphreys.
Good evening, how are we? Good. Kirsten, that's the accent you had there, was it Scotland?
It was pretty well done.
Yeah, fantastic. Scotland, well, I'm from England. And is there any Welsh people or Irish people in the audience? No? Oh, it's a shame because I've had the full set. So I went to university 7 years ago in Nottingham and Trent, and it was nice sitting here. It brought me back in a few years, and I thought, oh, I wonder how much technology would have come on in 7 years maybe. And it's great to see that we've gone from 1 to 2 screens. So we're going good in life. Alright, sweet. So STA travel. Can anyone tell me what STA stands for? Student Travel Agency. Alright. On your seat is a bag. And on the front of the bag, you will see our logo. And I have 3 words at the bottom. And what do they say? Start the adventure. Come on, you guys. You've been in uni for like 6 years, haven't you, or something like that? Go and read the bag. Jesus. Alright, cool. So, STA Travel. We were called Student Travel Agency back in the day, but we changed our brand because everyone just thought, oh, you know, it's just the students. We're not just for students, we're for everybody. So let's go through this. Here we are. So we're not just the students. We do have special offers for people that are under 26, 30 and under, and even teachers as well. You may know our part of access, I think it is here. We have the international student cards that you can use. They're not just for overseas, they're for Australia as well. You can get like 5% off Macca's, the cinemas. You just flash it out and say, yeah, student concession, whatever, and you know, put you on child seat or whatever. You think you get like 5% off Woolies and Apple as well, something like that. Anyway, so what are we about? What do we do? So this presentation I actually cut down today. I had about 10 slides of stuff that I'd actually never seen before. So I thought we'll stick with the flight stuff and we do other stuff as well. And you can see from your presentation, you guys do a lot of stuff overseas. So all them places, we can do flights too. There's no dramas. So I guess I just put it out there. Here's a couple of random world trips. So you guys have got placements. Why not make it a big adventure, pretty much? You know, the quickie. 2 grand, 5 stops into San Francisco, surface down to LA, over into London, down to Rome, Dubai, Asia, and back to Australia. It's not bad, 2 grand around the world. Some people are paying 2.5 grand to go to Europe return. And you got others there that carry on. So, what have I got to offer for you tonight? Everyone knows what lay-by is, right? I don't actually know what it is when I first came over to Australia. I was like, lay-by, I was going to go and park my car somewhere or something like that. So, lay-by, I think that you can do in Big W or Target or something. You pay a deposit or a fee or something, and then you can pay it off as you go. With STA, we are the first, we're a market leader, we can lay-by flights. So, take Kirsten's advice, be organised, and if you were going away later on in the year, we can basically take off you. What we're doing for you is $49. It's normally $99 with STA travel, and in March it's only $29. So you can pay us this month $29 for your flights. We will lock them in for you. STA pays the rest, and then 6 weeks before your flight, you come and pay it off. So you can save all that money during that time. Pretty good? Everyone agree? Yeah, cool. Bit of enthusiasm going on there. It is the end of the day, I'll give you that. Okay, what else can we do? 10% on small group tours. Anyone heard of G Adventures? Used to be called Gap Adventures. Amazing company. Yeah, we can get 10% off them, sometimes even more. 50% off New Zealand campus if you want to go to the pond. 10% off comprehensive travel insurance. Actually, you know what? We'll do 10% off any type of insurance that we offer. Flights to Europe one way, $699, and much more. So, what about with STA travel? We have exclusive cheap airfares. We do lay-by, and we've got a price beat guarantee as well. So you go onto our website, any others, Webjet, bring it in, and we'll match it for you on the day. And as you've probably seen outside, we're doing a sign up tonight, not for $500. We slipped you into the O-Week sign up, so $1,000. Get your names on there. When you walk out, we're just on the right hand side. Pop your name and an email on there. You got also a newsletter. It's an email that comes out once or twice a week with all the best deals that we've got going on. And yeah, you never know, you might win $1,000. And I believe that we've got a little presentation here to show you about the new launch of our blue tickets. Yeah, which you can like on. Thank you.
Hey, do you remember tag when we were at school?
What, as in, you're it?
No, you're it.
No, you're it.
You're it.
Okay, thank you, STA Travel. So, Work the World is our second sponsor for this evening. Work the World is an organisation that organises safe and structured healthcare placements that are tailored to your interests. They offer the whole package, including pre-departure information, full placement organisation, meals and accommodation, and 24/7 in-country support. Unfortunately, their representative can't be with us today, so we're going to play their video.
I had a few friends who had gone through the Elective Summary before, and they mentioned that it's been a really good experience. However, when I did go to the website, I found all the information that I wanted available.
So in terms of the kind of information we got pre-departure, it's all very useful to read through, very comprehensive information pattern. We got kind of stuff prepared for what is, as I said, a very, very different experience.
Organising was very hassle-free. There was very pre-departure briefing, and arriving here was hassle-free, so it was door-to-door transfers.
When we arrived at the house, I was surprised at how large it actually is. Despite how big it does feel like home, as it was for the next few weeks for me.
I felt really welcome within the team. They're really nice to me. They help me around a lot. In the hospital, they explain what's going on, and they act as sort of my interpreters.
It's completely different going to somewhere like Tanzania where everything you have to pay for, operations, down to sort of medication.
And consequently, because it costs so much to them, they present much later with much more severe symptoms.
Comparing the patients to those I've seen back home, I've seen significantly more advanced disease.
It's very good experience. The kind of thing you see in textbooks, and then you actually come here and see it.
Some areas have very limited resources, and how you can get by with very few tests and still do well for the patient.
So you have a lot of advice, and you will notice that you develop that.
GlobalHOME also gives to the hospital in terms of material needs to patients.
It's a great feeling going to the hospital and seeing that difference. And the stuff that we donated is actually quite appreciated by the nurses and as well.
It's a kind of stimulating plan. They benefit from us and benefit from them.
Aside from hospital placements, there was a lot of time for leisurely activities during the weekend as well as the afternoon when we had time off.
I definitely recommend work well with a friend. I recommend work well with friends who are actually in Tanzania right now. We've had very different experiences, and I'm definitely very happy with mine.
I'd also like to add that first years are eligible to apply for Work the World as well. All right, so our next three speakers have done a placement at Hoc Mai. Everyone seems to have an awesome experience there, and you can even get funded by a scholarship. So I'd like to introduce Alex, Jim, and Brian.
All right, good evening everyone. So myself, Jim, and Brian, we're going to talk a bit about Hoc Mai placements and also our experience in Vietnam in Hue in December of last year. So just briefly about Hoc Mai, for those that don't know, it's a non-profit organisation run by the university that aims to improve health outcomes through education and research in Vietnam and Australia. So basically it's an educational partnership between the two countries. It runs many projects, including advanced medical teaching, maternal and child health, research training, and several others, including the exchange program, which is where we come in. And it was set up to facilitate the forming of educational bonds and ongoing relationships between health professionals in Australia and Vietnam. So the program extends outside of medicine and includes nursing and physiotherapy and a few others. Practicalities, it's a 4 to 8 week placement for stage 3 for your elective. It is possible at a range of hospitals in Hanoi, but also around the rest of Vietnam, if that's your interest. As Professor Foster said before, if you're in stage 2 and you're applying for Hoc Mai, you want to get on it because it closes on Monday the 9th. And if you are applying, I'd recommend having a look on the website to find out more about the organisation through the annual reports and the student impressions. You'll learn quite a lot from that. Why should you go? It is a fantastic medical experience in itself. The doctors I were with, their physical diagnostic skills were second to none, and I definitely learned a lot from being there. But in addition to that, you develop great relationships that I think will be sustained throughout your medical career. There's a lot of medical students and doctors that I met while I was over there that I still keep in contact with and intend to well into the future. The Vietnamese people are so very welcoming. There wasn't a lunchtime or an evening where we weren't invited to a meal or invited to check out a site around the city or just to someone's home. So we were welcome from day one, basically. $1 is 17,000 dong. So if money's an issue, what? It is a very cost-effective country, so you will live quite comfortably, especially with the money that they provide you as part of the scholarship. It is an amazing country. This is the imperial city in Hue. This is probably a few hundred metres from the hospital. And also, doing a scholarship through Hoc Mai opens up the opportunity for future involvement with their projects in the future. So I think overall it's a very worthwhile experience. And I'll hand over to Jim to talk about what he did while I was over there.
Alright guys, hello. My name is Jim. So I spent a couple of weeks in the emergency department there, and unfortunately I didn't take any photos. I don't know if they were appropriate or not, but here I'm with the head of ED. So this is Dr. Lai on the right, and he's actually not an ED physician, he's a urologist. And this is the case in Vietnam for EDs all over Vietnam, because emergency is actually a very new specialty there. And most of them are manned by surgeons. And I got really hands-on there in Vietnam, which is really good, under supervision. And the good thing about, I guess, what I found really good was that you could actually follow a patient as they rolled in the door in the taxi, because there was pretty much no ambulances there. So they come in a taxi, and you say one guy had hurt his finger, put it in the machine and just kind of ripped it. And then, so you go with them to the radiology department, you take the scans, then you go with them, I scrub into surgery and I assist it. So it's really good that you get, the complete picture of care. Also wanted to mention, so very intimate involvement. One thing about this particular placement in Hue is the emergency department there is actually not very big, so 10 beds. So sometimes it does get a bit quiet, but the doctors are very friendly. So in my downtime, I just kind of went up to say, Dr. Fogg, can you just teach me how to do hand ties? And he'd sit me down for a whole day teaching how to do different hand ties. So really enjoyable in that regard, and I would totally recommend it. This is me with Dr. Lai. He's at his home, or his brother's home, and actually, very special occasion. You really get to know the doctors very well. This is actually the 4th anniversary of his brother's death, and he invited me to go, and I felt that to be a really special occasion. And yeah, okay. And the next experience I did was in cardiology. I did 2 weeks in cardiology, and this is me scrubbed up. Well, not really scrubbed, but I was in the interventional unit for 2 weeks, and on an average day we'll do about 3 or 4 cases, and angiograms, or maybe putting a few stents. What I found was language was really a barrier in the sense that when they're kind of talking, over pointing at this picture, I didn't know what they were saying, and perhaps in that regard it wasn't as informative an experience. Although the doctors were still very nice, they invited me out for dinners. Actually, this particular case sponsored by a drug company, and kind of they were invited to go together, and I was there, and I got to see the interaction. We were invited to a 5-star hotel, and they were there with this meal, and they actually, Hue is a very rainy country, and kind of you always go with an umbrella. So the drug companies handed out ponchos with like a big drug name in the back. I gave that away. I didn't want to bring it back here. So yeah, overall it's a very good experience, and I definitely recommend considering Hue as a placement. Yeah. Hand over to Brian.
Hi. Hey guys. So I had quite a different experience at Jim. So I was for the whole time I was in the trauma department there, so for 4 weeks. So this included orthopedics, plastics, and burns. And this is how they describe themselves. They're like jack of all trades. They said they were master of none, but I think they were better than that. So when we were there, they usually would have a couple of cases in the morning, a couple of cases in the afternoon, and sometimes on rainy days, which is a lot, they would have no one at all because nobody would come in because they didn't want to travel in the rain. I also joined in oncology with Alex and also endocrine, but in endocrine they also had neurology and pulmonology, which is kind of an odd combination. But everybody there was very receptive and friendly. And contrary to Jim, I found that the level of English spoken was actually quite high, and a lot of the trauma doctors had strong relationships in Estonia, out of all countries. And the head doctor had actually gone to many, many countries. He had studied in Germany, in the USA, in China, and Australia, and he was very, very worldly and had very high level of knowledge there. So while I was there, I was able to scrub in and assist very regularly. And while I was obviously not so capable, but they helped me along anyway. But the most extreme case that I did see with Alex was a Vellore tumor, which is usually a benign tumor, and it's a breast tumor, which was, in this case, 4 to 5 kilos. And I don't know if you can imagine, but it was probably the size of maybe a basketball or something. And that took quite a long time to solve. This is me foolishly trying to explain a chest x-ray. So it's very collaborative. They were just laughing the whole time, so I don't know what I was doing wrong, but whatever. This is Alex giving a talk in front of 4 doctors, so at a weekly meeting or something like that. What was this one? A multoma, something. Ileal multoma. Go study that. So they had long lunch breaks from about 11 to 2 every day. Most doctors went home to their families to have lunch, actually. So you'll be told probably that you'll get invited out a lot to eat with doctors over lunchtime, but I found that most of them wanted to go home and see their families. There was lots and lots of Vietnamese coffee, and it's just food, and it's so cheap. So very cheap. And that's how you know, going to a Southeast Asian country, you want to avoid fresh vegetables and things that haven't been cooked well, but in Vietnam, you really can't avoid that. And some people learn to cope with most things. One out of 3 of us didn't seem to cope too well. So this is a frog leg. So it's okay. But not as quite as bad as the next slide. So I don't know if you can see, but this is the world famous bullet, which is basically a duck embryo. Didn't manage to put something like that. Sorry. And so yeah. Do people want to go back and look at it? So yeah, this is just the 3 of us at that hospital. So yeah, I think we all really recommend the Hoc Mai experience. We were the first 3 to actually go to Hue. Most people end up going to Hanoi, which is where Hoc Mai has strong relationships. But Hue being probably a less touristy city, much smaller, we weren't flies on the wall. We were really involved, and it was a really lovely experience. Thanks. Thanks, Eric.
Thank you to the Hoc Mai trio. Next we have Hamish, who went to Vietnam and Thailand in first year and second year, and will probably go again somewhere in third year.
Is this one?
You want to use this one? Yeah.
Can you hear me? How's that sound? Echoey? Okay. Can you guys hear me on the back? Yeah, that's off. How's that better? No? Better? All right. Sorry about that. How's that? Okay. All right, so have a chat to you about 2 placements. One was at Chulalongkorn, which Kirsty's kind of introduced, and the other guys kind of introduced the other one as a Hoc Mai placement, but I was at the Pediatrics Hospital up in Hanoi, so slightly different experience. Here's Chula. It's a very big hospital. It's one of the largest in Thailand. Just gives you an idea of the scope. I did a lot of my outpatient work on the building on the far left, and the smaller building
the gap between the two larger buildings was where all the surgery was done. And behind it is the university. So it was established about 100 years ago, and it operates under the patronage of the Thai royal family. So it's quite prestigious. It's the teaching hospital, as Kirsty mentioned. It's got about 1,500 beds, about 1 million outpatients a year. Very efficiently arranged through, Kirsty's introduced in Mr. X. And there's a range of different placements you can do. You probably want to check whether these placements are available at the time you want to go. My placements was in Obs and Gynae, and you have a fairly structured routine, so they embed you in one of the teams, which is fantastic. There's about 7 in the team, broad range of experience, and you have a supervising professor. It just means you can develop the relationships over the 4 weeks and work with them as a team. And it's a fantastic learning experience. On the overseas placements, a couple of the guys have mentioned that language can be a problem. It's not really the case in Thailand, I don't think. Well, certainly not with the doctors, the professors and the team. I think more an issue when you do the overseas placements is just the level of confidence they have in their English. But once you're with them for a while, it's not a problem. Nursing staff and patients, slightly different issue in Thailand. Vietnam has its own challenges. Accommodation, you can either, as Kirsty mentioned, you can stay at the hospital or self-organise. I'm not quite sure what's sitting at the bottom of that slide, so I'll try and remember as I go along. So here's my team. So broad range of experience, and they're pretty self-sufficient, these guys. So the supervising professor's only there for 1 or 2 days a week, and these guys pretty much run the team themselves. The clinical skills are absolutely fantastic, particularly for the level of experience that they have. And there's Professor Surisit, so he was the supervising professor. That's how I used to get to the hospital each day. And this just gives you an idea of, if you do a placement, what a typical week looks like. And it's a great mix of surgery and clinical experience. So Monday you just have a general surgery day, and you see a broad range of procedures. Because you only have 7 in your team, and they run about 5 or 6 different theatres, there's plenty of opportunities to assist during the procedures. And the non-student members of the team, so there's only 2 students on the team and there's 5 who are residents, they pretty much run a lot of the surgeries. Tuesday's a really lovely day because you're following the mothers from the onset of labour through to delivery, so we call it delivery day. They have their own particular techniques in Thailand, which are really lovely when you see them. But there's opportunities to assist in delivery. Wednesday to Friday are outpatient clinic days. So you get general gynae on Wednesday, family planning on Thursday, and Friday's antenatal with the expectant mothers. 2 of those days you're just sitting one-on-one with the professors, and I think, as one of the guys mentioned, their diagnostic skills are fantastic, so it's a great learning experience. You're there for 4 or 5 hours, so it's an absolutely fantastic thing to do. And you do a lot of hands-on work during those clinics as well. Tuesday, Thursdays, you just have a team grand rounds. Wednesdays, you have a department grand rounds, and often that's in Thai. So sometimes the guys will translate for you, but for something like microbiology, you might go in a little bit later on that day. Wednesday to Friday, self-directed study days, so up to you to what you do, but there's some optional things, optional clinics you can go to if you're feeling keen, if you don't want to go doing touristy things around Bangkok. So here's general surgery, family planning, so Earth is second year reg, is just putting in a long-acting contraceptive there. antenatal day. That's a team grand rounds. That's someone, they're all the professors, so someone's giving a good presentation. That's the department grand rounds. So often in Thai, you can see there's a lot of yellow in that room, and it was around the time of the King's birthday, so that's his colour. 1 week, my background's in law, so I gave a talk on Australian medical negligence, which is pretty challenging, I have to say, because it's pretty technical. They're non-lawyers and English is their second language, so it was pretty tricky to adapt that. Monks blessing lunch one day. They had their end of year party one night, which was very funny. Also, when you do the placement, it's always nice to go with a few gifts, so I just merged them up with a bit of Sydney Uni stuff, which they liked. The placement I did for Hoc Mai was the year before. So the year before these guys did it, and I don't think Wei was available at that time. I did it in the Peds Hospital in Hanoi, which again is a pretty big hospital. This photo doesn't really do it justice. That probably gives you a better idea, but you can see, I guess, the different stages in the level of the healthcare journey that the two countries are on. It's about a third of the size of, say, Chula Hospital, but of course it's a specialist hospital. With Hoc Mai, at least in the year that we did it, so Hawaii wasn't available, but Da Nang was. But there's 1, 2, 3, 4, 5 hospitals in Hanoi. Each have a different specialisation. You can choose, all the details will be on the website, I'm sure. The Peds Hospital, so it's a leading paediatric hospital in Vietnam, and the main tertiary paediatric referral centre for North Vietnam. You can see there's a range of different departments you can go into. It does make a difference what department you go into as to what sort of experience you're going to have. My placement was in the neonate ICU. There were also 4 or 5 other guys the year I went, and they were in emergency surgery, and there was a physio. So a typical day there is quite different to a typical week in Chula. So you have the early morning hospital grand rounds. It's probably a little bit harder to find structure, or at least in NICU it was, around the day. So the routine I managed to get into after the first week was to do inpatient consultations with my supervising doctor, which was fantastic. So it's 4 hours around the wards, and the mothers are staying with the little babies. So that was a really nice experience. NICU is, the workload in there is pretty intense because they have a supervising doctor. They have 2 wards. Supervising doctor looking after 60 to 80 little neonates in the term ward. And she might have a little bit of support from some of the other doctors. For preterm, it's about 40 to 60, so that's a fair bit of stress. And there's a lot of different things that you can see there. And I think as one of the other guys mentioned, you see a bit more advanced disease wards than you may see here. The sort of access you get here over there is quite different from the sort of access that you get here as well. So this one was a little bit different to Chula because you need to be a little bit more proactive in trying to manage the experience that you got. So there was less structure, a little bit more flexibility for that year because there were some other guys in the hospital, so you could visit other departments, and that broadened the experience out quite a bit. It's a really nice student mix actually. The year we went, so we had a range of guys coming through Hoc Mai in different years from here, but also we had a mix of nursing, physio and other med students from other countries, so that was really good. Language barrier was, as the other guys mentioned, a little bit more challenging than Chula. In NICU, that was particularly the case, probably less the case in emergency. So in order to get information, you had to use your initiative a bit. So often that was the doctors that were using the echo spoke English pretty well, so you got an idea of what was going on. and having conversations with them at the same time. Accommodation's pretty easy over there. You self-organise with Hoc Mai, are really helpful in helping you do that. So that's Dr. Huang, who's a supervising doctor in for the term ward. That's Christmas time in NICU. Just the inpatient consultation with Dr. Ha. And they have these fantastic, yeah, I had to get one while I was there, but a little neonate stethoscope, which is very cute. You can see the size. So she's got one around her neck. Ellie and Kate in emergency, they had a really good experience there and saw a range of different things coming through. That was my first C-section, I think, assisting on that. And there's the result. Little Hamish, even though it was a girl. Nice places to visit too. Palm Bay, Supper is really lovely up in the border near China. That's lunchtime in Supper. We did a guided walk in the mountains, and May, our guide, took us to her house, and she was pretty naughty, and she had a couple of henchwomen with her. So the drink of choice up there is rice wine, and we thought we were pretty hardy after 3 or 4 weeks in Vietnam, but they did us in, and Erica, who's there on the left, could only walk sideways after lunch, and I think we left her in a ditch somewhere giggling, and I haven't seen her since, and Michael I haven't seen since either, until there's Erica there, until today, funnily enough. So Erica's, she's just visited 40 countries in the last year. She took a year off last year, so if you want some information about different countries, I think she's visited all of them over the last year, including Sierra Leone a couple of days before the Ebola epidemic hit, or you might want to keep your distance. I think she's okay now. So if you have any questions, feel free to send me an email. And a big thanks to Kirsty, Fiona and the OGH team. They do a fantastic job managing these relationships. And it really is it's a unique, fantastic life experience. So I highly recommend you do it. You do it in a challenging country, and you do it as often as you can. And thanks to Jason and the Hoc Mai team, because the work they do with the foundation is fantastic as well. Thanks.
I'm sure a lot of us are interested to hear from the next speaker who traveled to Uganda. Let's hear from Kelly.
Escape? No, next. Next. I'm taking it. One day. Oh yeah, cool. Hello everyone. Is that on?
No.
Hello, so yes, I went to Malago Hospital in Kampala in Uganda with one other Sydney student. We went for 4 weeks over January and February.
Is this on?
Okay, so just a few reasons why I could choose Uganda. It is, contrary to popular opinion, it's a very safe country, it's very beautiful, very lush. There's plenty for us to do on the weekends when we went to hospital. It's a really, really good hospital experience. You can get hands-on with supervision, of course. It's very relaxed administration, like really relaxed. And you can get flexible. The day that I started, I decided to change rotations and they had no problem with that. And they also organise a lot of activities. The university organises a lot of activities for you. Like they took us for this traditional dance evening, which was really fun, and it would have actually cost them a lot of money to take us all there. And it's very generous. They organise for language lessons in the local dialect. There's also heaps of other international students there. So when we were there were students from Belgium and Scotland and the US. So yeah, really good for meeting other people, and it's very affordable. So we ended up paying $15 a night to stay in like these suites on the top of a mall with amazing views. It was quite luxurious actually. So this is Malago Hospital. It's half of it's being renovated at the moment, so they squished the other half, so they squished all the patients into the other half of the hospital. So I think my experience was a little bit skewed. I don't think it's usually as hectic as that. So this is the view from our student accommodation, which is pretty spectacular. It's a really cool city, Kampala. This was the traditional dance night that they took us to. So this is some pretty crazy outfits from, they're actually Rwandan outfits, so they do like all of the East African traditional dances, which was really fun. And this is our language lessons. So the language is very varied across Uganda, and you're going to get people from all different tribes. So they teach you the Kampala language, but it's not very useful with everyone. But the good thing is that most people speak English. The only words that I learned in Uganda, because I did obstetrics, were push, congratulations, and that was like, you know, good afternoon and thank you and stuff. And the midwives taught me be quiet, but I didn't use that one. So my experience, I did 4 weeks at Malago. I did 4 weeks beforehand in Ireland, so I was a crazy sort of translucent white when I turned up and I got burnt to a crisp. I did 1 week of low-risk obstetrics, which is really interesting because I hadn't seen a lot of low-intervention births in Australia. It was pretty much like no pain relief whatsoever. There's definitely no forceps or anything like that. You pretty much just have to push it out and deal with it. 1 week high-risk obstetrics, which was in the main hospital, and that was really interesting to see a lot of interesting stuff. It's a huge volume of patients, so you see a wide variety of presentations. And 2 weeks in acute gynecology, which was really awesome. It was very confronting, but definitely not something that I would have seen in Australia. There's heaps of different options you can do. These are just some of the ones that people did while I was there. So the other student from Sydney did plastics, which was quite full on, I think. But if you're into plastic surgery and sort of burns and stuff, it's a really good experience. So you can see, yeah, there's a whole heap of different things you can do there. Emergency is very full on. The students pretty much get left with all of the admitting and all of the triaging and stuff. So I was involved in heaps of births. And I got to do a lot of postnatal care, got to stitch up a few tears after being told how to do it and seeing a few done. Got to assist in a lot of surgeries. So if you want to practice suturing, there's lots of that to be done. But please beware, because the registrars will try and get you to do way more than you're allowed to do, because the students there are allowed to do their own Caesars. In fact, I think they have to do their own Caesars by the time they graduate. So just be firm and say, no, I can't do that, because you can get in some serious trouble. Night shift isn't advised due to safety, unfortunately, but there's plenty to do during the day. Like I said, a huge amount of patients. So these are some pictures. This is the low-risk birth unit here, so it's quite rudimentary. And this was so these blue curtains separated the waiting patients from the delivering patients, so it was, yeah, you can see that it would be quite a noisy ward, but it wasn't, because they were all being told to be quiet. And this is the admission room where they were sitting if they were kind of in early stage labour, and you can see it's quite basic. They have to bring their own plastic sheets to lie on and that kind of thing, their own surgical gloves. That was me with my first delivery. The midwife wanted to take a photo. And then there's some of the midwives in the corner there who, they took a while to warm up to me, but they did eventually. This is in the high-risk ward, so this was the medical team here. They're the intern and the registrars and some nurses, and then that was me assisting in the cesarean. So they don't have scrub nurses as such, so you have to do all of the assisting, like handing instruments, so you have to actually learn what they're called, which I had no idea. And yeah, they get you to stitch it up, they get you to actually pull the baby out, which is pretty cool. And some more pictures of Malago. So you probably recognise it from the movie The Last King of Scotland. It's nothing like that, don't worry. So on weekends, I was only there for 3 weekends, which I really regret. I wish I'd sort of stayed a bit either side. But we went up to Sippy Falls, which is about 6 hours away. It's just spectacular. It's kind of coffee territory, and it's really cheap, like for accommodation, travel expenses, everything was about $80. You can also go whitewater rafting on the Nile, which was so good that we did it twice. And yeah, it's very affordable when you see what it includes. There's heaps of other things you can do, but yeah, I just unfortunately didn't have enough time to do them all. That's Sippy Falls, which is pretty gorgeous. The waterfalls. The coffee tour that you can do up there, which costs about $8. Bit of whitewater rafting, bit of fear. Just some tips. Do get organised early because the admin at Malago can take a while to reply. If they reply, so you have to hound them a little bit sometimes. Visas you can buy at the border for $50, so they're $150 to buy them in Australia beforehand, but everyone gets them at the border. Rolex is just the best thing. It's like this street food made of chapati and omelette, and it costs about 70 cents, and I didn't find out about it until my 3rd week. I was devastated. It costs about 70 cents. Yeah, make sure you have yellow fever certificate. That's very important for getting back into the country, because they'll quarantine you or make you have it again. And also make sure you take things for the hospital, because they don't even have SATS monitors most of the time, or like a blood pressure cuff. Like for example, we were trying to work out if a woman had eclampsia because she was fitting, or if it was her epilepsy coming back, and they couldn't even take her blood pressure to see if it was eclampsia, and just basic things like that. It's very under-resourced. So yeah, if you can take a few things like that, they'll just be so appreciative, and obviously leave them behind, don't take them with you. And yeah, definitely take a week or so at the end, because there's just so much to see and do, and it's gorgeous and affordable, and I highly recommend Uganda.
Thank you, Kelly. Okay, so Columbia University in the US is the most sought after of all of the Office of Global Health placements. Possibly for its prestige, but most likely for its location in New York City. So please welcome Ben to tell us about his experiences.
Where'd it go? Oh, there we go. All right. Hello, everyone. So I went to New York for my elective. I went to Columbia University. So why pick the USA? Basically, it's the world-leading country for medicine. World-leading institutions, world-leading researchers, incredibly well-funded institutions. While the healthcare system itself is a bit problematic, the hospitals have an incredible amount of money with which they can afford machines and imaging modalities and whatever else that they don't even have in Australia. So I was working one of my rotations really with the cutting edge in ophthalmology, imaging techniques that they only do at Columbia. So, and they really take pride in that as part of, Columbia is so great because we're the only place that does this. And they really emphasise teaching as well. So there's a big push for the junior doctors and the senior doctors to really make sure that the medical students that they have learn a lot and get through. And I think that's especially important for the US medical students because these rotations for them are all about getting a job. And there's plenty to see in it. New York City really offers, the entire experience as far as a destination. So while I was working 5 days a week in the hospital, 2 days a week were living in New York and getting to experience the whole thing. So yeah, that's like they like to advertise each hospital. So that's the Columbia ad, is that amazing things are happening here, if you can afford them. So during January, I was at the Edward Harkness Eye Institute. Basically, they offer the whole variety of clinics for the poor and for the wealthy. So the resident clinic is the poor clinic, where people often, it was quite sad because sometimes you'd say to someone, your insurance or your lack of insurance means that you can't pay $300 for your glaucoma drops, so you're going to go blind. And basically, everyone's hands are tied. So that's a bit of a bit of a problem when you consider how the private clinics were basically offering people, completely experimental things that were going to cure their vision. And also getting to see operations and assisting in operations, and watching them with people who are world leaders and who have developed these particular operations. It's a quaternary level centre, which means that we had people coming from around the world to get further opinions from the Columbia doctors. Weekly, our grand rounds actually consisted of a case presentation, but then a lecture from a world expert. So we had people from the UK, Canada, the USA presenting about all sorts of different topics. So I learned an incredible amount in a very niche specialty, obviously, but I picked ophthalmology because I thought, well, it's something that's a bit different. Don't get to do a lot of it in Australia, and given how strongly they advertised their ophthalmology institute, I thought, why not? It was less hands-on. It was a lot more observed than sort of interact, than getting in to do things. But I got to examine every patient that came into the clinic with the attendings, and I also got to see my own patients towards the end. It was very difficult though, because most of the clinics operated entirely in Spanish. That's one tip. For anyone who's planning on the USA, learn Spanish, because it's muy importante. So this is the Eye Institute. So the Eye Institute is actually 11 stories, just dedicated to ophthalmology. The main building of RPA is 11 stories. So the hospital itself is just gigantic, and it actually takes up 4 city blocks, which is phenomenal when you actually consider how big a city block is in New York. My second month was in Harlem, doing paediatric emergency, and Harlem's very much the polar opposite to Columbia as far as its kind of wealth and the socioeconomic status of the patients that come in. Within the paediatric sort of patients, there wasn't too many issues as far as safety. However, I know with the adult emergency being across the security door, very often things would happen that basically required police. And interestingly, Harlem Hospital actually has its own police force within the hospital. And it goes to show sometimes it wasn't safe. A nurse got shot while I was there. The hospital very diplomatically worded it as being catching a stray bullet, because she was actually walking by accident between a gang fight. So there are safety issues that you have to be careful about. Fortunately, it was all fine for me and the other students that went to Harlem. As for the paediatric rotation, I got to see patients, do the workup, treatment decisions and further disposition, but it was very supervised. So while I had the responsibility, it was very much supervised throughout that. And a very wide variety of presentations on acuity. So that's Harlem Hospital, which was very cold that day. So during leisure time, got to see the whole set of tourist sites in New York, go to the theatre, Book of Mormon, that kind of thing. Saw the Knicks play, which was good fun. A lot of different food. Went to Momofuku, a lot of different restaurants, street food. New York's got an enormous amount to offer. Shopping, of course, because you're in the USA. And going to other cities, so it's quite easy on the weekend to go to Philadelphia or Chicago, DC, all over the place. So one thing I got to see was, to be in Times Square for New Year's Eve, which was really, really busy. But it was good fun. So don't leave it too late. Applications open and close about 6 months before. So I think some unis, like for Harvard, for example, the applications open in June, July, and close in about September for December, January. Some of the places will need USMLE, so if you're not sitting USMLE, don't consider them. I think Johns Hopkins and Mayo Clinic both need USMLE, so just look into that. Pick your rotations wisely. Look at forums, ask previous students, consider university websites. Other students that I was with found that some of their rotations were actually different to how they were advertised, so you've got to be careful. Think about what your career plans are. If you're planning on going to the United States, working there, issues like letters of recommendation become very important. And also what you're interested in. I picked ophthalmology because it's something interesting. I picked pediatric emergency because emergency offers you a whole range of different things to see and things to learn about. And also I do enjoy pediatrics and read up. I mean that in the sense of read up about whatever specialty you go into for your elective, because they do expect quite a lot of knowledge from you, and they do expect you to perform. You'll be working quite long days. I didn't have to work very long. Like, I worked the clinic days, which were 7 till 5, but some people were doing 24 hours every 3 days. They enjoyed it, but it's, you know, you will work hard. It can be quite different because you are part of the team. You're functioning essentially as an intern in some of your rotations. While you're supervised, you are expected to really be working at that level. So it's definitely good fun, and there's a lot to see. That's the Freedom Tower, very American name. So flights, I had a very bad experience with student flights. Fortunately, STA Travel have flexible tickets, which is something that I didn't have and I regret. So make sure they're refundable or flexible, because it cost me a lot more to get home because I had to change my date of return. So that's something to be careful about, I think, for everyone. Accommodation, so in the States, a good website is Rotating Room. It's basically a student subletting website that you can find good accommodation in for it's affordable. Start saving, stage 1 and stage 2, start saving now. Stage 3, find money because it's really quite expensive and the exchange rate isn't helping. I think I started, when I first was looking at going to America, it was about 95 cents, and I was thinking, great, like, it's going to be really good. And it ended up being about 75 or 70 something cents while I was there. So you certainly have to pare back a bit to have the funds available. Start now looking at activities to do on weekends and that kind of thing. Don't use Broadway.com if you want to book Broadway tickets. They're a tourist trap. Learn Spanish. That's like, if there's one thing you can take away, it's learn Spanish if you're going to the United States. And wear warm weather gear. It was unbelievably cold, like minus 20 for quite a few of the days. And get waterproof shoes, because I ruined quite a few pairs of shoes because I didn't have that one bit of advice. So there's me, there's New York in the background. So I'd like to thank the Office of Global Health, Columbia Uni, the Eye Institute and Harlem Hospital for what was a phenomenal 8 weeks. I learned an incredible amount and had a great time. So there's, another New York thing to look at. And if anyone's got any questions, feel free to email me, Facebook me, whatever. I'm more than happy to answer any questions about the USA. I've got a whole list of different places I've looked at applying to in the States, so I've got plenty of other information for you. Thank you very much.
Next, we have a student who traveled 4,000 kilometers away from Sydney, which is far, but not far enough to leave the country. Please welcome Ingrid, who will share her experiences in Broome.
Okay. So yeah, my name's Ingrid, and as Graham said, I went to Broome Hospital. I did 4 weeks there, and I know it might not sound as fun and exciting and exotic as some of these other places that people have gone to, but I just want to preface my talk with, I cannot recommend it highly enough. Rural medicine, Indigenous medicine in Australia is absolutely incredible. I had a fantastic time, so yeah, I really, really thoroughly recommend it to anyone. So basically, I was really interested in doing a rural placement and an Indigenous health placement because I didn't do a rural year, and my rural GP placement wasn't as great as I had hoped. And I mean, I haven't been exposed to any Indigenous medicine at all since I've started medicine. I think I've treated maybe 2 patients. And I was a bit like, well, they can throw me wherever they want in my intern year, and I really want to have this experience so I'm not just in a lion's den and have no idea what I'm doing. And I mean, you sit through a lot of lectures with Leland and public health and stuff, and you learn about the plight of rural medicine and Indigenous health in Australia. But there really is no substitute for actually going out there and seeing it and being a part of the team and experiencing it firsthand. Because yeah, it's a completely different world. It's completely different to what you're picturing in your head and how you think it's going to be. And obviously, these services they're vital. They're a vital part of healthcare in Australia, and I think, as Kirsty was saying, it sometimes can get overlooked. You don't really think about, this stuff going on in Australia, but I have done a bit of work over in Zambia and Malawi and Mozambique in their health clinics and stuff, and it's the same sort of thing. Like, these patients are coming in really late in their disease progression, and I saw things I never heard of, and things that you sort of learn about, but not in a practical way, and you don't think you're ever going to see it. So yeah, it was really, really interesting. So like I said, when I was sort of deciding where I wanted to go, I was looking at, like I said, rural, Indigenous. I really like diving, so I was looking at places where I could go diving as well. So I was thinking Cairns, Exmouth, places like this. And I got onto Broome Hospital, and the supervisor called me back, and he was impossibly lovely. He was just the nicest man I'd spoken to. And I thought, well, I really want to work with this guy. So yeah, he organised it all, and we got going. But just little aside, if you are thinking of diving, you can't dive in Broome at the time that elective placement is, so just keep that in mind. Oh, wait, which way do I press? Oh, okay, yeah. So for those of you who don't know, this is Broome in the northwest Kimberley region of Australia, and that's just a little picture of Broome there. And this is Broome. It is absolutely, obviously I'm not a photographer, but it is visually just spectacular. This is, on my afternoons driving home, on my weekends just driving up, finding secret little places because they're everywhere, and it's just absolutely gorgeous. And it has this incredible history that I didn't know anything about, and I learned so much about Indigenous culture and Indigenous history that you just don't learn at school, and it was really, really enlightening and absolutely, yeah, just incredible. So it's quite a small town. There's about 15,000 people permanently there, so that's in wet season. Then in dry season it triples to 45,000 people. It was quite difficult to get public health statistics, but about 5,000 of the permanent residents are Indigenous. And they have, in terms of medical services, they have Broome Hospital, which is where I was based, and they also have the Kimberley Aboriginal Medical Services Council, which is CAMS, and that also runs the Broome Regional Aboriginal Medical Service. So these are the services that cater and advocate for Indigenous Australians and Aboriginal health, and they're also the programs that run the remote outreach clinics, which, if you're lucky, and I would suggest you try and get in contact with these types of services in rural towns, you'll get to go out. And so I spent a couple of days going out, fly-in, fly-out trips to some of these remote clinics and just working in these clinics with the GPs there. And because a lot of these little communities, they only have GPs come out once a week or twice a week, it's just packed, and you're just people coming in like this, and one patient comes in, you've got to call the RFDS for them, and then another patient is like, oh, we got to get them on the Bidgie bus to bring them back to Broome, and yeah, so yeah, it was really cool. But most of my time I spent in the ED, and I saw a lot of this, a lot of abscesses, a lot of skin infections, people like coming in because their knees and their feet have been so badly infected that now they can't walk, and that's when they decided to come in. Lots of dental abscesses as well. There's only one dentist in town, so there's a lot of dental problems. You look in a lot of kids' ears, there's a lot of otitis media. Scabies is a really big problem, it's difficult to treat. And just a lot of skin sores and things like that. What else was I going to say? Yeah, and so a lot of patients with, like, my first day I went up to Peds actually for one day, and I saw 2 kids on the ward. They had about 4 kids in the department, and 2 of those kids had post-streptococcal glomerulonephritis, and that was something that I learnt about, but not really ever thought I would see a patient with it. And in Broome Hospital, they had 70 children diagnosed with it in the previous year, And there was recently a study done on it in Italy, and they had like 3 patients over the past 7 years or something come in with this disease. Again, lots of people with rheumatic heart disease, like active rheumatic heart disease, and being treated. And actually, in the remote communities, they had recently just had an outbreak of tuberculosis. And trying to contact trace tuberculosis when people are walkabout, they're in the bush, it's really quite impossible almost. And also a lady who had finally accepted treatment for her Hansen's disease, which had taken them almost a year to get her to say that, yeah, she would take the treatment. So that's the remote communities. That's the little plane that you go out on. That's actually Beagle Bay Clinic. And then that little sign that says, you know, this is the one day that eye health are coming, the one day that dentists are coming, etc. And that's the treatment room in there. So basically, while on placement, I was allowed to do as much as I felt comfortable with and I wanted. I already mentioned a little bit, but I can't stress enough how incredible the staff were. They were absolutely fantastic. Right from the nurses, the junior staff, the senior doctors, everyone was just wonderful, and fantastic teachers and wonderful mentors. The nurses always made sure that I knew when there was a cannula or sutures or a catheter or even ECGs, just whatever I could get my hands on and do, they were there. They're like, right, get Ingrid, she's coming in. And then the junior doctors, because I mean, it's only a 36-bed hospital, and the ED is probably not as busy as the EDs here in Sydney, but so whenever we had time off, the juniors were taking me aside, giving me lessons, just teaching me whatever they could. At different times, we had resusces, patients coming in, and I'd sort of be standing in the back trying not to get in everybody's way. And the juniors were constantly coming up to me and just being like, you know, are you okay? Do you know what's going on? And just explaining to me everything that was happening. But a normal day for me, I'd go into the ED, start picking up patients by myself, take the history, do the exam, come back to the senior doctors and present my story to them, and they would ask, okay, so what's your differential? Give them my diagnoses, my investigations, and then, okay, so what's your treatment options? Give them my treatment options, and then you go right through, you take them through to radiography, you to admit them, or you go through the pharmacy, there's no pharmacist on staff or anything, so you go through the pharmacy, you compound their medicines, you do whatever you need to do and bring it back to them. So no one was ever too busy to help. Everybody was constantly there and always ready to like lend a hand, to supervise me, to listen to me, just to do whatever it was that I wanted. So while I was there, I mean, I really improved my procedural skills. I feel very comfortable now doing a lot of things that I'd never done before. My diagnostic skills, I got a lot of short case practice, which is really going to help me with my lung case at the end of the year. And I mean, it's just those practicalities of what it's like doing rural and remote medicine and what you have available to you and what you don't, and sort of how you get around that and what you do. Because obviously in tertiary hospitals, you're getting patients from these areas. So it's sort of nice just to be able to say, oh, okay, so this is sort of what's going on out there. I've got a better idea of it. And again, like I already said before, but sort of just being in with the Indigenous health and like treating these patients, most of my patients were Indigenous in the ED, and just like being right in there and learning what it actually is like to work with Indigenous people and their healthcare. It was really fantastic. So in terms of practicalities, like I said, I looked at a map and sort of looked at where I wanted to go. And I chose Broome, and again, couldn't recommend it highly enough. But there's lots of places that you could go. I mentioned a couple like F9 and Cairns, but places like Darwin, Derby, Port Hedland, Alice Springs. A lot of the doctors from Broome had been in Kununurra, and they absolutely loved it. Said it was just gorgeous and fantastic. So I sort of just have a think about where you want to go. give the hospital a call. I was cold calling. I just call them up, tell them who I was, ask if they could put me through to someone, if they knew who to speak to. You sort of get passed around, but eventually you get through to people. You can go through universities as well. So Broom's actually affiliated with the University of Western Australia, and sort of try and do it that way. I found it easier going through the hospitals. And so the one thing that might be a bit different, because it's sort of self-organised placement, is organising your accommodation. Don't be afraid to ask the hospital if they have any accommodation available, or just going to them for advice for where to look for accommodation. That was probably the hardest thing for me. But I had plenty of people to help, and just things like transport and stuff, just have a think about it. I think everyone has pretty much already said it, but don't leave it too late. So I unfortunately was a little bit late and got really lucky. I don't recommend that at all. Because a lot of places that I was trying to go to said no, because they had students from their university going there and they couldn't handle another student. It's just something that you really have to think about at first and get things organised and get things going. But I mean, I know that Broom would love to have more students. They were, very accommodating, very happy to have me, so they would love to have more. So that's my name. I'm Ingrid, and that's my email address. If anybody wants to get in contact with me, I can give you the details for Broom or for CAMS or anything if you're interested. Again, it's just something to have a think about. Don't just push rural Australia and Indigenous medicine aside. It's really important part of Australia and like our healthcare system, and it's amazing. So, yeah.
Thank you, Ingrid. Okay, our next speaker flew across the Pacific to Peru. Please welcome Django.
Yeah, sure. Hi, everyone. Good talk. Thank you. It was my birthday on the weekend, and you just don't recover in fourth year like you do in first year. So I've got a little bit of a cough. So good afternoon. Thank you, everyone. Thank you so much, GlobalHOME, for putting on this event. I know a lot of work goes into organising Electives Night, and you've done an outstanding job this year. Well done. So I'm Django. It's my pleasure to be speaking to you about my elective. I went travelling for 4 weeks with my girlfriend, then spent 4 weeks in Peru doing a range of things. I came home, spent 2 weeks in the emergency department at Westmead, and then 2 weeks of trauma surgery in Westmead. So I remember when I was in third year, I was a bit confused about the timing of elective. So this is what it looks like. Maybe I was slow, but everyone else seems to have got it before I did. So you have December, January, and February to do pretty much whatever you want, learn whatever you want, anywhere in the world, and you've got a bit of time in March as well. So I guess a good place to start when you're thinking of planning your elective is what you want to get out of it. So when I started thinking about my elective, there were 4 things that I wanted. I knew I wanted to travel to South America because it's somewhere I've always wanted to go. I knew I wanted to learn Spanish because I've always thought it was a very sexy language. I wanted my is Kirsty still here? Okay. I've written some specific phrasing for this. I wanted my elective in South America to be not too medically intense. On the other hand, I wanted my elective to be at home, to be a time to explore my medical interests. So, So this is what I did for my elective. So those 3 countries in December are Mexico, Bolivia, and Colombia. Yeah, good. And then, then a month in January in Peru, and then flying home to Westmead. So tonight I'll just be speaking to you about Peru, and I might show you some of those travel photos that the pathology professors always do when you're in first year and second year. They used to annoy me, and here I am. So this is the that's not the Indian Ocean, that is the Pacific Ocean. And this is South America. And this is Peru. And this is Trujillo, and this is a beautiful city on the coast, 20 minutes from one of the longest left-hand surf breaks in the world, and it has about 1 million people, a mixture of very rich and very poor. I should tell you just how I ended up in Trujillo. I'm extremely lazy, and that whole GlobalHOME boat had sailed long before I looked at my elective. And the thought of sending emails back and forth to hospitals in South America and getting replies in Spanish was too much for me to handle. So this is what I did. I went to the Electives network and I clicked on that ready-made electives tab. And then that eventually a few clicks later took me here, and I saw that photo and I was like, "Ooh, yeah, all right." So I paid my $250 deposit, and that was it. It was done in about 5 minutes, and everything was organised for me. So I forgot about it for 8 months, and then 8 months later, I was here in Hospital Florencia. It was small and quiet on some days, but very friendly, and I had such a good time there. There were 4 blocks, one for clinics, one for emergency, one for obstetrics, one for surgery, and there was also a little paediatrics block sort of on that side. So a typical day for me would be waking up at 7 a.m. I would eat breakfast with the woman whose house I was staying in. I was staying in a homestay. Her name was Anna. Then I'd get picked up at 7:30 by my driver, Garling. We'd go get Ben, who was the other Australian medical student at my hospital, who I became really good friends with. We'd get to the hospital together around 8. Then we'd discuss what would be medically interesting for the day, and we'd go wherever we wanted in the hospital and see just whatever was fascinating for the day. I would finish up at the hospital around midday or 1, then go back to my casa to have lunch with Anna. Then I would go to language school for 4 hours till 6 p.m. And in the nights we did whatever we wanted. So that usually meant going out, having dinner and getting drunk. So the days were very busy and very full, with about half my time split between learning Spanish and learning medicine. And we travelled every weekend, which was fantastic. So I'll just show you some photos, some medical stuff. So this is a cataract operation. So we removed some cataracts. I didn't actually do any of this surgery, thank God. But it was very interesting, and this was the first time I'd ever seen any opthal surgery. So that was really cool. And the operating team was really nice and really sweet. And they threw me a party when I left, which was very nice. That looks like a uterus, and that is a uterus with lots of fibroids that we removed. This was quite an obese woman that had managed to stretch her abdomen so much that she had multiple hernias popping through the fascia, and we were repairing them. She also had cholelithiasis, so we did an open cholecystectomy, which is something, if anyone's surgically oriented, you don't really see many of those here. Does anyone know what this is? So this is tuberculosis, and it is spread right through this man's lobe. And this guy was the reason that I got checked for TB when I came back, and I'm very happy to announce that I'm TB free. This is tuberculosis again, isolated to the upper lobe. So there's lots of TB in Peru, lots of gastro, lots of communicable diseases. There are also plenty of non-communicable diseases as well. Peru has a serious obesity, diabetes, hypertension, hypercholesterolemia problem. But there were lots more communicable diseases than you would expect to see here, which you sort of expect for most third world countries. Okay, so I have some stories to tell you. This was a special day. So the day I took this photo, and the next few, it was in a place called Alta Trujillo, and it's the poorest and most dangerous part of Trujillo. And the only reason we were able to see it was because Dr. Rubin, the director of the hospital, organised an ambulance to take us up to this very poor area. And I didn't realise this till later, but an ambulance is pretty much the only vehicle you can get into this area, because the police and other vehicles can't get there. Apparently if they do, they don't come out. Ambulances are safe for a very short period of time, only during the day, because there's an agreement between the doctors of the town and the mafia bosses that the mafia won't kill the doctors as long as the doctors treat the mafia medically, which they often do, particularly on Saturday apparently, because there's lots of gunshot wounds. So I guess this was a special day because I got to see what was sort of really happening under the surface of South America and some of the corruption or the levels of corruption in this country. When I was in Alta Trujillo, I had this funny conversation with one of my teachers, Rocky. We were walking around, and I asked Rocky, "Would you walk around here at night?" And he replied, "No, it's dangerous now, during the day." And I asked, why? Are we at risk of being robbed? And he replied, robbed? We're at risk of being murdered. So that was fun. Anyway, so the reason why ultra trujillo is so dangerous is because of this guy. And as you can see, there's this beautiful house. And all around this beautiful house is slum, like real slum. People have no water, they have no electricity, their walls are made out of rubbish, plastic and wood, and children are playing in the dirt. I asked Rocky while we were passing this house, so who is the guy that lives here? And he replied in his, I can't do a South American accent, I delinquent, he's Indian. And I asked, what do you mean? Like a mafia boss, a drug dealer, or a terrorist? And he answered, yes, all of those things. He lives here because he feels more safe and he can see the police coming, and the police are blocked off if they come here. They cannot escape. As I'm sure most of you are aware, there is a huge trade in narcotics, women and children in South America. Corruption is endemic through every level of government in Peru. In Trujillo, there's 5 big mafia bosses, and this is the home of one of them. About 35% of the population pays money to the mafia in order to be protected from being robbed, murdered, raped or killed. This is another funny story. So on this day, so this is Rocky right in front, Ben's sort of in the distance, and there's another doctor with us. We were doing home visits, they're called Padamis. And so we were seeing this woman, and she's 100 years old, probably the oldest woman in Trujillo. And I have no idea how she managed to get to this age, because she lives in a really, really rough neighbourhood next door to a marijuana dealer. And so there were heaps of very strange sort of druggy people in this area. So while we were seeing her and chatting and drinking tea and doing medicine and having a good time, our driver outside is actually being held up by a drug addict. And apparently the story goes like this. We were inside speaking to the woman, and the drug addict was trying to hold up our driver. So first he tries to rob the driver. The driver says he won't give him any money. And then the drug addict goes and gets his other drug addict friends to ambush us while we're inside the house. So when we come out, they can rob us. Anyway, while the drug addicts are getting themselves organised, our drivers called the police, and we sort of come out of the house just in time to this great comical scene of all these drug addicts running around being chased by police. And then we just hopped in the car and went on our merry way, and everything was fine. So, a few bit of a pros and cons list to summarise the elective. It is very easy to book your elective through an organisation. You don't have to deal with the toing and froing of emails, some things falling through, then booking your accommodation. It's very easy for someone to just let you do it, and it saves a lot of time and energy. Safety, as I've said, definitely is an issue in Peru. So it was really good to have things like a driver, live in a house that was built like Fort Knox in a wealthy area, and I wouldn't have had any idea what a good area was if I went there by myself. The company I went with, Medical Electives, had great staff and good support. There were always people at the hospital to introduce me to doctors and get me to see what I wanted to see. I loved that I was with a bunch of other medical students and doctors, and there was such a great community vibe. There was no way I could have learned as much Spanish as I did without a language school attached to the hospital. So the teacher, and I have to say the teaching was exceptional. My teachers were kind, funny, patient, professional, and they all taught at universities or schools during the day. So if you want to learn another language, this is a great way to do it. And Medical Electives was a great cause as an organisation. They frequently bring in teams of doctors to Peru from all over the world, and I was really lucky. They offered to set up a clinic for me if I'd like to come back when I'm a doctor, and they'll pay for everything, which is fantastic, and I hope I'll be able to take up that opportunity one day. I guess the biggest con is that it is kind of expensive. Not too expensive, I think, and I certainly think it was worth it, but obviously it's up to you how much you spend. I suppose I did expect to be getting my hands a little dirtier, and that didn't particularly bother me, but it did bother some other students. South America is a destination. It's got some pros and cons. It is breathtakingly beautiful. It is a bit dangerous, but it kind of makes you feel a bit more alive. But it was so much fun, and I would go back in a heartbeat. So that's it. If you have any questions, I didn't put my finger on DNAT 7169, and that's all. Thank you. There's a few travel photos I promised you, and that's my little school family. All right, thank you.
Please please welcome our last speaker of the night, Sally, who went to the UK.
Hi, I'm Sally. I'm a fourth year student, and I know we all want to go home. My parking has expired, so I need to be quick. So I did an elective in London. So as Django explained very nicely, you have December, January, February. I chose to do my London elective in January. I travelled 5 weeks to Europe in December with my partner, and then I'm finishing off my second 4 week here in Sydney. So these are the contents. I'm talking from a more logistics point of view, not so much about my experience, which was fantastic, but more logistics, which would be helpful for you guys. So what to expect? It's pretty much how much you put in. You can consider where you want to go, if it's a geographic location you're interested in, or your area of interest. You can pick a specialty, or otherwise you can think of a medical or surgical attachment that you won't get during your year 3 and 4, for example, neurosurgery or renal attachment that you might not get. So that can be quite helpful for exams, but if you're thinking of picking picking a subspecialty, it's good for your interest, but maybe not so helpful for your exam. So think about what you want out of your elective, and also some electives are very observer-based, some are very hands-on. So I'm a bit of an organised person, so this is what I did at the end of second year. Because I wanted to go to London, but I didn't know what medical schools there were in London or what hospitals there were, I did a bit of research and I looked up all the medical electives possible in London and in its surroundings. So yeah, I looked up when applications open, what dates are available for the electives, and what are the requirements. So whether you need a CV, a letter of recommendation, references, dean's letters, things like that. The dates are updated, but this was very helpful for me. So I did mine through University College London. It is likely that some of you will go to London via UCL because it's quite popular. So they have a written application and an application fee of £100, and it opens on a certain date. So I put my application in a year in advance. It's now changed to 6 months in advance, so it might be a little later than you'd hope, because I was quite happy to have mine approved 1 year in advance. That gives you a bit of a safety net, I guess. They require an academic verification, quite a simple form that you take to your electives coordinator at your clinical school now. Previously it was done through Dr. Bandler, I believe, but now it's through your clinical school electives coordinator, and the dean of your clinical school will sign off and stamp for you. You also need to show the insurance form provided by SMP that's available on Blackboard, and it renews late in October, so you might need to pick up the renewed one when you go off for elective. You've also got a vaccination form that you need to get done by your GP and send that off. And the thing about a London elective is you need something called a Tier 4 visa, which is a study visa that you can only get 3 months prior to the start of your studies. This makes it very difficult, for example, if you plan on studying your elective in February, but you actually leave the country in December. So because you only have that 1 month to get your visa prior to leaving the country. It made it very difficult for me because I was in Vellore from January, October, so my final month of term year was very busy running around getting visas, trying to get them approved, paying more fees to get it done on time, things like that. Yeah, and UCL applications are quite expensive. Once you do the application fee, you pay a tuition fee, which equates to about $1,000 now. And also you need to get a blood test done once you're over there to double check your serology. So that has another fee on top as well. Currently, the dates available are 4th of Jan to 12th of Feb, and the deadlines close, the deadlines are 4th of July. So they open soon for third years. In terms of application and approval through the school, you've got an online application via Blackboard, and there's a deadline for this. For us, it was about November, so it'll be the same for you guys. You need to write up your own learning objectives for each elective. If you're doing 2 4-week electives, or if you're doing an 8-week and a 4-week, you need to write up learning objectives for those. There is a deadline, but they are quite flexible if you have last-minute changes to your elective. If you don't get your visa on time, but you reach your deadline, they're happy to change your application for you. So before you go, you need to think about a couple of things. So visa is very important, especially if you're going to 2 different countries for your electives, which require 2 different visas, because some can take 3 to 4 weeks to obtain. And your passport will be at the centre, so you can't do anything for those 3 to 4 weeks. You need to think about your passport renewal, so you need at least 6 months on your passport before you go. Consider travel insurance, that's important. Application documents. Money and cards are important to prepare before you go, so whether you're thinking of credit cards or a debit card with good international fees, that's something to think about, and other medical gear that you want to take to London. So I went to the Heart Hospital, as I said. It's in a suburb called Marylebone. It was in central London. It was about 15 minutes walk to Oxford Street, about 30 minutes walk to Piccadilly. And my experience was really great. I was the only full-time student there at the time, perhaps because I put my application in straight away. It seems like a first come, first serve basis. I did have one supervisor, but I was free to go between various departments. So 1 week I spent on the general cardiology ward, another week I spent in cardiac ICU. Some days I spent in interventional capital labs or cardiothoracic theatres. And a lot of the time I spent in outpatient clinics, which was really good. They also provided pharmacist teaching once per week with some other UCL students, and that was really, really useful. The hospital pharmacists in London are really, really knowledgeable. And I learned a lot about prescribing, which we don't get much, I believe, in our program, so it was really helpful to learn to prescribe and things like drug infusions. You also learn the similarities and differences between the healthcare systems. For me, I felt that it was very similar. The experience I had, I guess in Dubbo and at my Metropolitan Clinical School was quite similar to the experience I had in London as well. The NHS and the Medicare system are quite similar, I believe. In terms of the first week when I was there, it was a bit difficult because I needed to enroll, I needed to get my blood test done, I didn't know anyone, and the team keeps changing. The consultant was only there about 2 days of the week, so I had to find people to attach myself to. And I also learned that it's sometimes better to follow a resident or a registrar during your attachment because the consultants are always on their phone or away, travelling. These doctors are the best in Europe, so they're always off somewhere. And yeah, so in the end, it's what you make of it. You can be there for as long or as short as you want at the hospital, but just make sure you introduce yourself, work out your timetable for the next week, and you'll be set. When you're done, you've got an elective report, so you've got a 700-word reflection. If you're doing 2 4-week electives, you'll have to do 2 700-word reports. And on top of this, you've also got an IPM elective report. As far as I'm aware, this hasn't changed. So it's a 500-word reflection, and the outline is all on Blackboard. So essentially, if you're doing 2 4-week electives, you've got 3 reports to do, and for us, it's due at the end of March. Other general tips for London, so it's very, very expensive. It's probably as expensive as New York, if not more. The dollar is absolutely horrible at the moment. I did my accommodation through Airbnb. This is a very good option if you're thinking of doing your own accommodation. Also, sharing with other students who may be going to London is also helpful. So someone in our cohort organised a spreadsheet to fill out your name, where you're going, when you're going, and that might be an option if you want to pair up and find accommodation together. Get one with a kitchen. Eating out is very, very expensive in London. Essentially everything is expensive in London. Try to get accommodation near the hospital so you can walk rather than catch the tube or a bus. That's saving you a lot of money. And the ATMs and no withdrawal fees. Travel, entertainment and shopping is awesome in London. So on weekends, going to Europe going out of London to other parts of Europe, very, very easy, very, very cheap. And if you don't get an elective in Oxford, then you can do a day trip to Oxford. So yeah, London is really beautiful. I can't really I don't really want to brag about it. I'm sure a lot of us want to go to London. It was really fantastic. I did a lot during my weekends and my evenings, and it's likely that you'll bump into some colleagues on Oxford Street. So yeah, so you can contact me, I guess through the coordinator would be best. Thank you.
All right, thank you to all our student speakers. Don't leave because we have a little present for you. We'd also like to thank our sponsors, STA Travel and Work the World, for attending our event. So I hope tonight's presentation has sparked some sense of adventure in you. And if you have any questions, feel free to email the speakers today, or email me, because I have all their contact information. Okay, good luck with your application.